Okay, if we could just ask everyone to take a seat. We are going to start in just a few seconds. Great. All right. Well, it's my great pleasure to welcome all of you to this workshop hosted by the Forum on Microbial Threats. I'm David RELMAN. I'm on the faculty at Stanford University, and I want to welcome all of you on behalf of myself, the two vice chairs of the forum, to my right, Lonnie King, to my left, Jim Hughes, and also on behalf of wonderful staff, including Cece Mandaka Shah, who is directly to my left, as well as Anne and Ayano, who are somewheres behind me. Oh, no, to the far right, Ayano Ogawa, and Antron, who is, I think, oh yes, behind, to the left. I also want to welcome you on behalf of the Board on Global Health here at the National Academy of Medicine, and Julie Pavlin, who's the director, is here on behalf of the board. And also want to thank all of our sponsors who have made this and our other activities possible, without whom none of what you see and will hear would happen. So thank you all. As you all know, the forum is now in its 21st year. It was established in 1996 as part of a wonderful early effort to help explore what emergence of infectious disease meant and what its impacts and implications were. And it focused on both science and policy, and that has continued to be the big theme and MO of this ongoing activity. The forum, as you know, provides a structured opportunity to discuss where science and policy meet on issues surrounding detection, surveillance, mitigation, response to emergence and reemergence of infectious disease. And although we don't formulate recommendations, we have discussions that lead to interesting observations, collaborations, and I think insights that have all kinds of important consequences for continued discussion. The topic that we are going to address this afternoon and tomorrow is one that in some ways intersects with topics that we have addressed previously. So this issue of urbanization is one that that certainly relates to more traditional issues of emerging infectious disease, such as vector biology and human migration and crowding. But urbanization, of course, is an important and worthy topic unto itself. And there's now a good body of science and important policy to be made that relate to this amazingly accelerating trend towards crowding and urbanization around the world. I think the numbers now have crossed the 50% of the world's population threshold. So a year or two ago, I think it became relatively clear that more than 1/2 of the world's population resides in cities. And those trends are only accelerating, and they concern parts of the world where there's a great deal at stake with respect to infectious disease. Much of the work on urbanization has focused on food and water and sanitation, energy consumption, but there are some really important issues having to do with the implications for the transmission of infectious disease. And so that's the focus here. What do these trends and phenomena mean for transmission pathways of infectious disease? This meeting will have 2 sessions, one this afternoon, one tomorrow. The first on drivers and the second on interventions, essentially, and policies. And as with other topics, we really want to be thinking about and working towards strategies for intervention and policies that enable intervention that will have meaningful impact on the lives of people and environments and everything else included within. So to help get us started, we have two speakers who have kindly agreed to provide their perspectives. One was labeled a global perspective and the other a local perspective, but as you will see, they're both global and local, of course. And so without further ado, I will introduce the first of our presenters, who is Christopher Dye. He is currently Director of Strategy, Policy, and Information in the Office of the Director General at the World Health Organization. I'll just mention that, that Christopher was previously at the London School of Hygiene and Tropical Medicine, where he headed vector biology and epidemiology. He joined the WHO just a few years ago, actually more than 20, and has led some really important work on the large-scale dynamics and control of some of the most important communicable diseases in the world. As Director of Strategy now, he serves in essence as the science advisor to the Director General and other senior staff. And I'll just end by saying he's also a fellow of the Royal Society. So Christopher, welcome. Thank you for joining us.